Welcome to the American Diabetes Association 2015 edition of JDC Diabetes GEMS video. In this edition, we bring you the latest in diabetes, presented at the ADA at Boston, USA. ADA, as you are aware, is the biggest diabetes convention in the world, and it is the oldest, and this year it is the 75th annual convention. One of the major attractions of the ADA was the presentation of Adipose trial, the cardiovascular outcome trial with the use of sitagliptin. And everybody was looking forward to whether gliptin group of drugs were cardiovascular safe or not. But already the results were out, and we had enough data from other clinical trials as well. And ultimately, in a clinical trial which was conducted among more than 14,000 subjects, half of them on sitagliptin and half of them on placebo, and all of them were continuing their usual therapies. So it is found that Januvia or sitagliptin doesn't produce any major cardiovascular effects. It is not only cardiovascular safe, but also it doesn't produce any major side effects, including malignancies. So now there was a question. There was a $1 million question. Are we justified in conducting these cardiovascular clinical trials with anti-diabetic agents? It all started in 2007 when the first report of myocardial infarction with rosiglitazone got published after analysis of several clinical trials. But ultimately, it was proven that rosiglitazone also doesn't produce any heart attacks. And from the emerging data from the gliptin clinical trials, from the emerging data from the GLP-1RA clinical trials, clinicians and patients are now assured, and we are confident with the use of these newer agents. And we are now confident with the evidence that these newer agents will not produce any cardiovascular events and are absolutely safe for clinical use. From Jothydev Diabetes Research Centers, we had a couple of original research papers in the ADA Boston this year, and I will briefly go through some of them. One paper was on the requirement of periodic continuous glucose monitoring in type 2 diabetes. We recruited more than 300 subjects and did CGM at baseline and then repeated at an interval of 3 to 6 months, and we found a significant reduction in the HbA1c values in all therapy choices, among all therapy choices. So we compared the A1c reduction in those on oral medications, on basal insulin, on basal plus, on basal bolus, and on insulin pump therapies. And we found the robust reduction in HbA1c most pronounced in those patients on insulin pump therapy, whereas even among those patients on other therapies for type 2 diabetes, periodic continuous glucose monitoring, and when the graph and the patterns were translated into advices in terms of diet, change in exercise, change in the insulin regimen, or addition of an oral agent, etc., resulted in significant reduction in the A1C and in the significant reduction in hypoglycemia, and enhanced the confidence of the physicians to go for more aggressive therapies. In another study conducted by Dr. Rebecca Vitale from Yale University, She did this study at Jothydev Diabetes Research Center. She compared two modalities of therapies. One a limited therapy and the other one a comprehensive telemedicine managed therapy in type 2 diabetes. And she found that compared to limited therapy, there is a reduction not only in the HbA1c but also in other parameters including blood pressure. When the patients are periodically educated, motivated, and the therapy is being modified through the telephone or the email. And looking at the outcomes, it is justified to make a comment that compared to limited therapies, comprehensive management of diabetes will help us prevent the onset of costly complications of diabetes. Let us move on to the next paper, a very relevant one. A mix of a basal insulin with an ultra long duration of action, that is degludec, with one of the safest and tested GLP-1 agonist, and that is the liraglutide. And this combination is not yet available in India, and that is sultofy. The combination tresiba with victoza. So obviously it will have the benefits of a basal insulin and the benefits of victoza. And this is the evidence on basal insulin compared to a GLP-1 monotherapy, and you have the third component, which is the mix of two. When these two therapies are combined, a profound reduction in the HbA1c, a more pronounced reduction in fasting, in postprandial glucose, and again a modest reduction in the body weight, reduction in the hypoglycemia, and the nausea and vomiting, a probable precluding side effect of liraglutide, is almost eliminated when it is combined with the basal insulin. What is the emerging role of adiponectin, the hormone from the adipose tissue? When the adiponectin levels are low, we are metabolically unhealthy. There is low insulin sensitivity. Whereas when the adiponectin levels are high, we are metabolically healthy. And the Bandin lecture enlightened us on more of adiponectin. It plays a key role in the beiging of white fat in response to cold temperatures and other triggers. It is a key mediator for the maintenance of metabolic flexibility, and it is one of the most important of the metabolic intermediates in uridine. Uridine is important in thermoregulation, cell growth and proliferation, in reproduction, in insulin signaling. Uridine is important in the control of blood glucose, in the protection against ischemia. Uridine biosynthesis in the liver is balanced against gluconeogenesis. In conclusion, adiponectin is emerging as a marker for diabetes and for cardiovascular risk. And now there is an emerging role for the development of adiponectin receptor agonists in the therapy of diabetes and metabolic syndrome. Another breakthrough in the cholesterol lowering drug research. There was a big start in the ADA highlighting the new drug class, and it is undergoing the clinical trials, the PCSK9 inhibitors, pro-protein convertase subtilisin kexin 9 inhibitors. And these new drug class, human monoclonal antibodies, promotes the clearance of LDL from the blood, that is a bad cholesterol, lowering the LDL cholesterol. Thank you for viewing our American Diabetes Association 2015 updates from Boston. And this is from Jothydev Diabetes Research GEMS video team. And immense thanks to all your feedbacks and suggestions. Goodbye from Boston. See you next month. Bye bye.